Günaydın. Good morning, everybody. As usual, starting to make sure if the connection is okay, if you can hear me and see the presentation. I need confirmation for every group. Hello? Yes, good. Yes, also أكيد الجروب الثاني همنا أفران هيفا. Okay. So before I start, I get a message from Tarek Mahmoud today asking if I can send the PDF before the lecture, and as I said before, unfortunately, it's my habit. I don't know if it's good or not. Until the last minute before presenting my presentation, I continuously add and remove things from the lecture. So until presentation, it will not be prepared finally. So it might be difficult for you, but I will try in the future if I'm not deciding to changing the lecture continuously. So I might send the PDF before, but there's a controversy. So if I send the PDF before, you might not sitting and hearing and trying to understand what I'm saying. You will just open your PDF or PowerPoint and just looking at these points, and you're not following me in the lecture. We will resolve this in the future. Okay, so today lecture is radiobiology. You might see it composed of about 35 slides, but don't be panicked. You will see the slides are repetition. Most of these will be repetition, image, and graphs, which is, you'll be happy if I say these graphs are not included in the exam, just for you to understand, but you will see a long slides, not long slides, a long lecture with a concise slides with repetitions. As I say every lecture, so each lecture is a continuation of previous lecture. If you don't understand the simple things from the previous lecture, it will be hard for you to understand or follow this lecture. And all lectures are like this until we get to the next lecture, which is the radiation protection for the operator and for the patient. Later on, we will start with talking about uh, the techniques, periapical techniques, and biting, and going to panoramic, CBCT, and other things related to dental radiography practically. So let's start. Radiobiology. What do you mean by radiobiology? Is the study of the effects of ionizing radiation on living systems. Okay? The initial interaction between ionizing radiation and matter. Last lecture we talked about matter, and here when we say matter, we mean human being. So the initial interaction between ionizing radiation and matter occurs at a level of electron within the first 10 power to minus 3 0.003 seconds after exposure. So fast. So the initial interaction started so fast. The change results in modification of biological molecules within following seconds to hours. So the first interaction happened within parts of seconds, milliseconds. So the change that happened after that lead to modification of biological molecules within seconds to hours. What happened next? The molecular change may lead to alterations in cells and organisms that persist for hours, decades, and possibly generations. So look. So these changes may result in injury or death. So what do you mean by radiation injury? We talked last lecture about what happened when the radiation hit the matter. So not all X-rays pass through the patient and reach the film. Some are absorbed by the patient tissue. And here is the problem. Because when we take a radiograph, the aim or the desire or the hope is to pass all the X-ray photons pass through the body and hit the film to get what a radiograph, an image. But unfortunately, this is not the case. Some of these absorb. So what happens when X-ray energy is absorbed by patient tissue? Chemical changes occur that result in biological damage. See, you might count the slides by slide after slide, but every slide composed of simple things. And this biological damage can happen through two things. First, ionization of the matter or of the atoms within the cell. And second is formation of free radicals. Ionization. Don't be confused. Before, we talked about X-ray and other rays as they are ionized radiation. And when these ionized radiation hitting the matter, of course, there will be interaction with the atoms within the matter, and another ionization will happen. So we are talking about ionization now within the cell. Don't be confused. I've got a question for few weeks ago from one of your colleagues here on the online lecture asking about X-ray as an ionizing radiation, how this will ionize the matter. So of course, wherever X-ray or any ionizing radiation or any other radiation hitting matter, there is a molecule, there is atoms, there is nucleus, there is electron around these atoms. So there will be electrons ejecting, and at that time, every ejection of the electron from the orbital it will be unstable and will be ionized. So this trying to be stable by fusion or by interact with other atoms. So how? That's why I say don't be confused when hear about ionizing or ionization of the cell. Again, X-ray is a form of ionizing radiation. We know that. When X-rays strike patient tissue, ionization will happen. Again, here we're talking about ionization of the atom within the patient tissue, within the human body. You remember from last lecture, we talked about ionization is produced through either photoelectric effect or Compton scatter. If you have read the previous lecture, it will be easy to follow this one. When we say what happens when X-ray hit the matter. Four things. One of them is transmitted and changed. Second, photoelectric effect will happen, absorption. Third, Compton scatter. Some of these will be absorbed, some of these will be scattered. Fourth, it was coherent, totally scattered. So now, for the ionization, for the radiobiology, these two, photoelectric effect, absorption, and Compton scatter are important. By these two ways, the ionization will happen within the human cells or tissues. So X-ray photon interact with tissue. What happens? It may lead to ionization, excitations of the atoms, and break bonds of these atoms. What will be next? There will be chemical change. You have chemical composition of any atom, of any cell, or any molecule. When there is ionization, excitation, break the bonds automatically. These might interact or might rebound again to form the same atom, or there will be a change. So at the end, there will be a chemical change. And this chemical change within body called biological change. Okay? This was about ionization. The second one, free radical formation. This is more important because this is mostly happen within the body because it depends on water molecule, and the body consists of 80% of the body is water. So here will be some problem or most of the problem from ionization. It occurs when any X-ray photon ionizes water, the primary component of living tissue. So X-ray photons interact with water in cells. Ionization will happen, free radical will form. I don't know if you remember what I mean by free radical. Now with this next example, you will understand it. X-ray photons hitting the body, hitting water molecules, ionization will happen, and this water molecule will be break down to its base atoms, hydrogen and hydroxy. Hydrogen which is positive charge and the other one is negative. So water is stable, but hydrogen and hydroxy are unstable. And this is the ionization. So here, the hydroxyl is a free radical, and it's very active. A free radical is an uncharged neutral atom. Here we have the minus and plus, I just mentioned that. It might be wrong. It's better to just don't mark that as minus. Some of these will be hydrogen plus and hydroxyl minus. Some of these will be hydrogen plus and hydroxyl without any charge. So a free radical is an uncharged neutral atom or molecule that exists with a single unpaired electron in the outermost shell. It's highly reactive and unstable. Its lifetime is 10 to power minus 10 يعني انه نضيف عليها 10 نقاط 1 سكند يعني ملي سكند يعني lifetime is too short. It's very active. It needs to reach a stable state. It's unstable. So what will happen next? To achieve stability, free radicals يعني انه صايرة حالة يعني كلش غير مستقرة بالفراد فري راديكال تحاول توصل للاستقرار by combination. What will happen? If it's recombined without causing any change, we will get a water molecule again. And that's good. That's good. So راح نرجع صار ionization صار free radicals and recombine again and we have got H2O again. But the other problem is when it's combined with other free radicals and causing change. Other free radicals in the body, we have carbon, we have any other things, any other atoms in the body. If these are combined with these free radicals, there might be change, and the change will be either good or not, according to the new molecule or new combination. The problem is when it's combined with ordinary molecule to form a toxin. Here, if you have got two hydrogens with two oxygens, we will get H2O2, which is here this end result is more harmful to the body. It's a toxin. And here this is the problem of free radical formation. Hydrogen peroxide. So theories of radiation injury. We have got these two types, ionization and free radical. Now the theories. It's either direct effect or indirect. Why I'm talking about ionization and free radical? Because to prepare you to understand this part of the lecture. So radiation acts on living system either directly or indirectly. So direct effect, it's count for about 1/3 of biological effect of X-ray exposure. When ionizing radiation direct hits critical area within the cell, for example, DNA. When the ionizing radiation coming to the cell and directly hit the area. This is the direct effect. Direct injuries occur infrequently. Why? Because most of X-ray photons pass through the cell and cause little or no damage. If you remember again from the previous lecture, some of these pass, some of these scattered. Few of these will be photoelectric and absorption or Compton scatter or Compton absorption. So most of these going through the cells without any change. So the direct effect will be less. The problem is with indirect effect. About 2/3 of biological effect of X-ray exposure. How it's happened? X-ray photons are absorbed within the cell and cause the formation of toxin, which in turn damage the cells. Example, H2O2 cause cellular dysfunction and biological change. This is by production of free radicals. And so it was not directly. The direct one is directly hitting the DNA, for example. The indirect, it goes around the water molecule, ionization, free radical formation, recombine, and formation of toxin. So as I said, the chance for indirect change and free radical formation is high, because cells are about 80% water. So إذا جات لكم بالامتحان true false or multiple choice على هالشكل راح تجي. يعني إذا choose the right answer, مثلا the chance of indirect change and free radical formation is high because of cells are about 80% water. يعني مباشرة نفس النص يجي. If I change that and say the chance of indirect change and free radical formation is low because of cells are about 80% of water. And at that time, if you choose this answer, it will be wrong. It is high, not low. Okay? These are some hints just to make you concentrate on the lecture and to be familiar with the type of the questions according to the lecture. There will be no questions outside the lecture or outside what I am talking about now. So try to attend and try to concentrate. Now we coming to another subject. It's related to this biological harmful. It's about dose response curve. As I said again, this curve, it's just for you to understand what I mean when I am talking about each one. It's not obligatory to know that, but if you read the lecture and if you understand it, it will be easy for you even to draw the curve. But again, it's not mandatory, but unless you understand the lecture, it will be so easy. So what we mean by dose response curve is a curve is used to correlate the damage of tissue with the dose of radiation received. So accordingly, we have the first one called threshold curve. Here we have dose and we have the response of the body. Each of these on the x-axis we have dose, on the y we have response, dose and response. The first one, threshold curve, indicates that below a certain level, which means threshold, no response is seen. For example, if we start exposing patient to X-ray until a certain dose, you will not see any effect according to this threshold curve. So some cells, some tissues need a dose X, for example, this amount of dose to start to make change in that cell. So this is calling threshold curve. So until it's reached this threshold, so the response will come like biological change, either cell injury, cell death, mutation, and whatsoever. So this is called threshold. There is a threshold. The second one is linear curve. Indicates that the response of the tissue is directly proportional to the dose. It's straightforward. Increasing the dose, the response will be increased. زي بالنسبة الدوز automatically الانجري والresponse of the tissue will increase. So this is the linear curve. So it's directly proportional to the dose. The last one, and this is the very, very important one, it's linear non-threshold curve. This one, last one, indicates that a response is seen at any dose. Be careful. That's why I am always saying don't expose yourself and the patient for radiation, because in such dose the biological change would happen. But based on the non-threshold one, it's not depending on the dose. 10 people irradiated with radiation, 9 of them might not get any change, 1 of them might get effect of that or injury of that either. It's not be seen because the dose is too small or too low, but it might hit DNA somewhere, it might hit cell somewhere, it might cause free radical, it might cause things and things and things. That's why linear non-threshold curve is, it suggests that no matter how small the amount of radiation received, some biologic damage occurs. So this is dose response curve, and it will be repeatedly, it will come, we will come across this repeatedly in this lecture in different ways. Don't be confused. Okay? So results of exposure to X-rays at cellular level. These are cells. What will happen? The cells will be injured and it will be repaired and changed. That's good. Okay? Cell may lead to death. Again, this is good in a way. Mutation is not good. All these are probabilities. When any X-ray hits cells, the cells may undergo damage and repair, damage leading to cell death, damage leading to mutation. Mutation may lead to cancer, may lead to any other gene if it's from gene in the offspring generation في الأجيال القادمة. So this is the problem. So we have many slides. It will be like repeatedly, you will see some things, but it's just to bring your mind or bring your attention into the lecture to see these adverse health effect of radiation exposure. This is a finger of an operator or dentist used the finger many times to expose their patient to periapical X-rays. What happened? Too high X-rays exposed many times, so it leads to burn. And it's in a way, it's a type of cell death. And some of these will be repaired. And this is what we see by naked eye. And I always say the problem is X-ray. If changes happen without knowing or without having a chance to see it, this is obvious, burning. But if something happened within the cell and the change lead to mutation, so we cannot feel or see it until catastrophic change happens. Okay? So these health effects can be divided into somatic effects and genetic. From its name, somatic effects occur in body of the irradiated individual. This individual be irradiated with a high dose of X-ray, or there's an atomic bomb, or there's any leakage from atomic factory, like it happened in Chernobyl and in Fukushima in Japan, or from Hiroshima, Nagasaki, or from Halabja, from anywhere where you have radioactive or chemical. This was chemical in Halabja, but in any other areas in Iraq, when the coalitions in 1991 used uranium, used many of these what they called like intelligence weapons. So اليورانيوم المشع وهكذا. وعندنا آلاف التقارير انه لا يزال عندنا اجيال تجيب اصلا بجنوب العراق او غير مكان انه بيها مشاكل خلقيه، مشاكل صحيه. فthese are the effects. The somatic effects occur directly on the irradiated individual. شايفين الفيديو البنيه اللي بدها تنهزم من جابان من هيروشيما انه كل جسمها محترق. هاي تقريبا صارت انه مثل ايكون. The genetic effects occur in the bodies of the offspring of the irradiated individual due to effect on the gonadal tissue. فهي راح تجي في الأجيال اللاحقة offspring genetic. So this is the first division of the health effect, adverse, somatic and genetic. So genetic effect manifested in offspring of the person irradiated. هاي هم شفناها atomic bomb problems، وهاي الأجيال اللي وراهم واللي وراهم واللي وراهم إلى أن الله أعلم إلى ياجي راح تستمر المأساة. شوف إنه إذا تشوفون سلايدات إنه تبين سلايد ورا سلايد بس بيها repetition، بيها صور. Again, we said at the first, it can be divided as somatic and genetic. Now, it can be again divided, the adverse health effect of radiation exposure to tissue reaction. If you see the textbook, the tissue reaction previously called deterministic effect, which depends on the threshold that we talked about from this dose linear. The other one is stochastic effect. Stochastic, by its name, it's chance or effect with a probability. So this is non-threshold. So the stochastic effect is more problematic, in my opinion. Tissue reaction is a problematic, but we can see it, we can deal with that. So we have tissue reaction and stochastic effect. So in many slides, we are talking about these in detail separately. Again, so the adverse health effect of radiation, we talked previously about somatic and genetic. So somatic effect can be subdivided to tissue reaction or stochastic effect, but genetic one, it's just stochastic effect. So all genetic effects are stochastic. Somatic effects include both types. And this is will be a nice question, a nice multiple choice in your exam, maybe. Okay? If I say all genetic effects are stochastic, it's true. If I say all genetic effects are tissue reaction and stochastic, it's false, and vice versa. So let's talk about tissue reaction. Tissue reaction like erythema of the skin, hair loss, reduction of bone marrow cell production, cataract formation of eye, and radiation sickness. Radiation sickness, it's like a syndrome. It's composed of many things. At the end, the patient is not well. All these can be seen by naked eye. Erythema of the skin, when there is redness, there is burning, there is hair loss. And this is not just about the radiation. We have radiotherapy. Many of patients have cancer and undergo radiotherapy. So you will try to kill the cancer cells. And by the way, you will see the patients will get many of these harm effects by losing hair, by erythema, by even induction of new cancer. And this is the problem. All these, when we talk about tissue reaction of the radiation, it's not about only X-ray, but at the end we will refine it to X-ray. It's all about all ionizing radiation and all doses. But these can happen in higher dose, not in a single dose or a simple dose. So these are very high threshold doses, okay? Like atomic bomb or very high radiation exposure. You will get to a nice example. I assume all of you will be panicked with this example. Let's see. So tissue reaction, again, large part of killing or malfunction of cells following high doses. Again, tissue reaction, in summary, there is a threshold. Before this threshold, we cannot see this tissue reaction. So threshold dose below which does not occur. Okay? Thresholds are different for each type of reaction. Straightforward. It's not every threshold, every reaction will happen. Maybe at X threshold, eye cataract will happen. With Y threshold, skin burning. With S threshold, other thing will happen. So each one, it depends on the type of reaction. Once threshold is exceeded, severity of reaction increase. Straightforward. Here we have the threshold. The harmful effect will start going further with the dose, so the tissue reaction or the severity of radiation reaction will increase. What's good for tissue reaction? Sometimes all these changes can happen. Recovery process that will occur. And again, the recovery process might include, if the cell is dead, cannot do anything for that. If the cell can be repaired, that's good. But if a mutation have started to occur, it's not good. But anyway, there will be some time or some sort of recovery. This is about tissue reaction. Thresholds are too high for relevance of dental radiography. Of course, we say tissue reaction will happen with high doses, high threshold. So all dental machines, periapical, OPG, and even combined CT scan, have the dose is not too high to activate, to make this threshold or to reach this threshold so the tissue reaction starts. But again, we are saying this is not a problem. If tissue reaction not happen, stochastic will happen, and we will continue with that. Look at this catastrophe. It's almost was something to happen to me, but thanks God we could manage that. This is from a report from a UK incident. Radiation injuries received by a newly installed dental X-ray set, which here they mean dental periapical one. In most of the clinics, they have dental X-ray in the treatment room or in the room that the dentist is working in. Description of the incident. An unsatisfactory installation of a new dental X-ray set led to a dentist suffering radiation injuries. The X-ray set had been installed in such a manner that it operated continuously at any time that it was switched on. Do you remember when I say when the switch on the board is on, try to make the switch off of the control panel. Look, this is in UK, not in Iraq, but there was a problem in the machine. So that the X-ray is operated continuously at any time that it was switched on. But this was not noticed by either the dentist or the installation engineer. يعني الدنتست قاعد بالغرفة مالته وجهاز مال X-ray داخل الغرفة، ده يسوي حشوة، ده يسوي قلع، ده يسوي whatever he do with the patient، and الجهاز بصفه ده يبعث X-ray continuously. يعني لا دقيقة لا دقيقتين. So the dentist spent about 90 minutes close to the X-ray tube head as he familiarized himself with the equipment in his new surgery. بالUK اللي ما عايش بالUK من يقول new surgery مو هي new جراحة. دائما الدنتال كلينيك يسموها dental surgery، ما أعرف ليش، بس هو هذا يحبون يطلقون أسامي ما أعرف ما تنطبق ويا الواقع. بس his new surgery that means his new dental clinic. He then noticed that the tube head was hot and switched it off. 90 دقيقة continuous emission of X-ray automatically يعني الكبر والأويل ما راح يتحمل، فإنه شاف إنه التيوب هيد كلش حار فطفى. دائما نقول إذا شيء خرب عاد نطفي وشغله، فهو طفى. A few days later, the equipment was switched back on to take a radiograph of a patient. Almost immediately, the tube head exploded in figure, spreading oil and debris across the surgery. يعني surgery the clinic. Not only missing the patient in the chair at the time, هو ده يريد يجيب التيوب head near the patient to take a periapical X-ray، وكان مطفي، اجى شغله واصلا كان خربان من المره السابقه فانفجر. شوف الراديولوجيكال consequences. A few days after the above sequence of events, the dentist developed skin lesion on his right shoulder. جهاز التيوب head كان قريب من right shoulder. And in his mouth صار عنده ulceration. There was also temporary opacity of his right eye يعني cataract. So the subsequent investigation concluded that the dose is right in his right shoulder was around 20 sievert. راح نجي على هاي الوحدات. What we mean by sievert, what we mean by millisievert. 20 sievert. Chromosome aberration analysis indicated that his whole body dose was about 240 millisievert. The dental nurse present at the time was likely to have only been exposed to scattered radiation هو الطبيب كان قريب من الجهاز، الدنتال نيرس اللي الاسيستنت كانت وياه انه كانت بس اجالها scatter radiation and her dose was probably 0.2 millisievert or less. So this report is never written in Iraq, and I don't think it will be written. So this happened to me, and I said many times when I was doing my research in master's degree in 2006 to 2008. There was a leakage from the X-ray tube head from the backside. So whenever I stand in the next lecture, I will talk about the radiation protection for operator. I was stand always in the safe area, but unfortunately, this safe area wasn't safe for me because there was leakage. Unfortunately, it was a digital X-ray, and I have got enough X-ray radiation, but not exceeding the annual limit. But it was too high for that time. Okay, so these things can happen. This was about tissue reaction. The second one is the stochastic effect, which we say it happened by chance. If two persons exposed to radiation, same amount of radiation, below threshold dose, one of them might get stochastic effect or effect by chance, the other one might not get that. The tissue reaction that exceeded the threshold, it will happen to everybody. خلونا كلنا هسه خلينا بداخل العياده القسم الدنتال اكس راي الموجوده بالقسم، ونجي 10 ساعتين 3 نقول الاستاذ معاذ تعال سوي اكسبوجر كونتينيوسي، كلنا احنا قاعدين هناك واحد ورا الثاني عبالك بده يعدلنا. الدوز اللي راح ناخذها كلنا بالناحيه التشو رياكشن راح تبين علينا البيرنينج، الكاتاراكت والمشاكل الاخرى اللي related to tissue. But the stochastic one اللي will happen by chance، قسم من عندنا راح يصير عنده وقسم من عندنا ما راح يصير عنده. So this is cancer development in exposing individual owing to mutation of somatic cells. شوف هنا المثل ان again a part piece of the newspaper maybe from the UK, 700 cancer cases caused by X-ray. هم قديمة بشوفوا الحالات 700. Heritable disease in offspring owing to mutation of reproductive germ cells. So either will cause cancer or change in the offspring by mutation of reproduction of germ cells. شوفوا الخط هنا أنا مسوي لكم إياه، هذا اللي قلناها اللي قبلها depending on the threshold. Here we have threshold and the adverse effect will start. But coming to stochastic effect, do you see these dot lines? This is linear no threshold model. Here in this area, effect will happen in some persons, that's not happen in the other. But this is by chance, by probability, stochastic effect. So this is information from International Commission on Radiological Protection. I have these like references for you if you have time to see these, and there will be much more than this in the future lecture, because as I said, always we lack of this information in our country. We don't have any guideline, we don't have rules, we don't follow even any guidelines, any international guidelines. All UK and Europe, Australia, Canada, and USA are following International Commission on Radiological Protection, except our region. Okay? Coming to stochastic effect, to summarize that, no threshold dose. That means no safe dose. هنا اجي اقول لكم من واحد يجي يقول انه الدوز كلش قليل بدنتال اكس راي، it's like nothing. No, it may not cause like tissue effect, but it will, when you come to the stochastic one, it will have effect. So there is no safe dose. هنا المحزن المبكي والمضحك، شركة هناك كورية تبيع دينتال بيري ابيكال اكس راي، اعتقد كل العراق تبيع بأربيل، شفت واحد صديقي سبيشالست PhD عنده مخلي له الجهاز يقول له انه هذا يسمى سيف دوز، فما تحتاج لا تخلي لي ولا تكون بعيد من الجهاز ولا اي شيء. يا اخي ماكو سيف دوز. احسب انه انا رحت للعياده شفت انه مخلي له غرفه صغيره يم غرفه الانتظار، يعني مرضى هنا والاكس راي هنا. قلت له احسب انه هسه انه a child or a pregnant woman sitting here. لا لا لا، قال لي سيف دوز. قلت انه اذا الاكس راي بالنهايه راح lead to a radiograph، يعني there is a some sort of x-ray، صح؟ فانه ماكو سيف دوز. بس شوف العقليه الماركتينج شلون يبيع. شوف عقليه الطبيب الاخصائي اللي ما عنده المام بالاكس راي والهزر. سيف دوز، الشركه قالت لي سيف دوز، هذا وما عندي مشكله. ذاك اليوم كان اكو بالقسم واحد ما اعرف انه اخته بصف رابع خامس شاعتها اكس راي، هو جامعه الاشق باربيل صف ثالث يعني هم يضحك. جاي ياخذ اكس راي، اخذوا له 2 بيريد 3 بيريد الى انا وصلت. قلت له ليش كل هالاكس راي عندك انديكيشن؟ لا دا اسوي على مود اختي. شنو بدك تسوي على مود اختك؟ شو راحوا اجوا راح ناخذ OPG. ليش؟ هم راح تاخذ اكسترا دوز. راح هو بكل عقله هو شطاره او عن او شو اسمه انه تضحيه من اجل اخته. كل شيء راح اسوي قال من اجل اختي. يا اخي انه غباء هذا. تعرض نفسك الاكس راي وانت مو انديكيتد، يعني اختك ايش راح تسوي؟ اذا كلش راح تجيب بيشنت انديكيتد تاخذ اكس راي من اربيل جاي وصف ثالث كليه طب اسنان، وعلى اساس تفتهم بالشغله. والطلاب اللي وياك صف ثالث هم جماعتنا بالكتاب، يعني ما شاء الله عليهم. اهم شيء ياخذ كيس لانه قالوا له لازم تاخذ كيس اذروايز راح تاخذ زيرو. شوف الاسباب اللي تخلي انه الواحد دائما يوقع بالخطا. فهو انه باله انه راح اضحي من اجل اختي. اوكي يلا تمام، هذا وصلت الفكره. فش تسوي له هذا؟ يعني بالشلاليق الطلعه. على العموم ركزوا على stochastic no threshold dose no safe dose. chance of effect increase with the dose of radiation. هو صح stochastic، بس كل ما الدوز يزداد automatically a chance of its happening will increase. no recovery process. الكانسر اذا بدا راح ينتهي مأساة مال الكانسر. الميوتيشن بالجيرم بالجونادال سيلز اذا بدا راح ياثر على الاوف سبرينج. So this is the problem of stochastic effect. The linear no threshold model provides a prudent practical basis for the practical purpose of radiological protection. المحاضرة الجاية راح نجي. The management of risk from low dose radiation. الستوكاستيك اللي راح تخلينا نفكر، لان واحد راح يجي يقول لك اذا tissue reaction تحتاج so high dose until the reaction or adverse effect happen. سو ليش احنا خايفين من دنتال اكس راي OPG والبقيه؟ انه ما راح نوصل الدوس اللي راح يوصلنا الى التيشو رياكشن. بس عندك ستوكاستيك افكت راح توقفك will stop you and saying that now is enough. Change can happen even with low dose. اوكي؟ شوفوا البلاوي بالابحاث. Look at this. Radiation exposure from CT scan in childhood and subsequent risk of leukemia and brain tumors. A retrospective cohort study. Medical diagnostic and therapeutic ionizing radiation and the risk of thyroid cancer. A case control study. Dental x-rays and risk of meningioma. Dental x-rays and risk of thyroid cancer. Brain and salivary gland tumors related to prior dental radiography. Implication for current practice. And many other studies and many new studies are coming and updating about the harmful effect of radiation. So it's not a joke. As I said, no safe dose of radiation. Risk of cancer and age, again, whenever you are young, you are more critical to getting the radiation effect. Getting older, the effect will decrease. Here we have the age at exposure, 0, 20, 40 years, 60, 80, and 100 years, and lifetime cancer risk per unit dose. Look, female and male, always female have more problems than male regarding to the radiation. So whenever they are younger, they are get more effect of radiation and going down until 100 years. إذا عشنا 100 سنة إنه خل ناخذ أشياء زايدة من عمرنا 90 أو 100 سنة. But before that, if there is no indication, so try not to take even a single radiograph. Okay? If there is indication that I will talk about this next lecture about protection, when there's justification, we have to take this radiograph. So we will balance between the harmful effect and the benefit of the radiograph. So risk of cancer and age عندهم أشياء كلش حلوة. No, they try to persuade their people to don't overexpose, so they have like a companionship saying image gently. شوف image gently يعني بكل هدوء. يعني إنه don't increase that for children especially. Look at that age group by years, multiplication factor for risk. Less than 10 is multiplied by 3. Same dose applied to any child less than 10 years or an 8 years. The effect for child will be multiplied by 3. For 80 plus will be negligible risk. 10 to 20 about multiplied by 2. Most of you are about 20, 21 or between 18 to 22, 23. 20 to 30 years multiplied by 1.5 and so on. These are the harmful effects and risk of cancer according to the age. Last part of our lecture today, it's about dose, radiation dose. I don't know if it's about 10 minutes to finish this. Are you ready to continue or do you want to leave this to next lecture?
دكتور والله يا ريت على نيكست لكتشر لانك بس مسار نتناقش به اذا عندك مجال.
تمام. هذا راح تصير قضايا معادة ما يمكن بالنهاية لو ما عندك. بس انت قلت نيكست ليكتشر، طرفين ثلاثة على الأقل يقولوا نيكست ليكتشر، مو بس انت.
نيكست ليكتشر.
هو أنا صوتي فتحت الموضوع وإلا كنت أمشي بيه عادي. بس قول للطالب نيكست ليكتشر يقول لك نيكست ليكتشر. تمام. إذا حسيتوا نفسكم تعبانين which is إنه from first minute عادة الطالب يتعب، فراح نخليه البقية الدوس للنكست ليكتشر. فإذا لا راح نكمل. بس أتصور إذا نكمل بسرعة خلنا نعطيكم نبذة خاطر تكونون مهيئين المحاضرة الجاية. هم راح أبعث لكم إياها، هم راح إنه نحاول إنه نراجعها الأسبوع الجاي خاطر إنه تكون أسهل لكم. Okay? So what do we mean by dose of radiation? صارنا ساعة بدنا نحكي dose limit وهذا يعتمد على الدوز وما يعتمد على الدوز. So dose, transfer of energy from radiation to atom. This is dose. So any energy absorbed per unit mass is called absorbed dose. صارنا ساعة بدنا نحكي على كمية absorbed dose. So it's the unit is joule kg minus 1 and this is called gray. The unit of absorbed dose is gray. But in dentistry and medical field, we are not dealing with absorbed dose. There are many other things to deal with. But absorbed dose is the first thing we use it for quality assurance for the device. So we have some devices to testing the absorbed dose, ionizing chamber, and dose area product. It's called that meter. So these performed by medical physics expert, MPE. أشخاص خاصين. I deal with them. One of my co-supervisors in University of Manchester was medical physics expert. فاستفادت منها كلش من ناحية الفيزياء. فهاي شغلتهم يجون يقيسون الابزورب الدوز مال كل جهاز. عندهم بالدولة بالجايد لاين بالريجوليشن انه لازم هذا الجهاز ما يتعدى هذا الدوز، فلازم كل مرة يقيسوه. فأجهزة القياس هي ionizing chamber بالنسبة للدنتال اكس ريز، بالنسبة للكومبيم سي تي والاو بي جي عندهم تقريبا دوز اريا برودكت دات. الميجرز ابزورب الدوز از ان ملي جراي لان جراي كل شوية في الملي جراي. So milligray centimeter or milligray millimeter called dose with product. هاي ما مجبورين تدرخوها, but just for your information. Milligray centimeter square centimeter called dose area product. Okay, these for measuring the absorbed dose. Okay, but different type of radiation have different damaging potential for the same dose. These calling weighting factor. X-ray weighting factor is 1. Electron weighting factor is 2. Proton is 1 again, sorry. Proton is 2. Alpha particle is 20. For every radiation, because we are dealing with X-ray, so we have to multiply the absorbed dose by this weighting factor. Absorbed dose اللي راح تقيسها medical physics expert multiply by 1. So here multiply by 1, that's mean any absorbed dose reading by these machines, it will be the equivalent dose. It's called equivalent dose. So equivalent dose is absorbed dose multiplying by weighting factor. So absorbed dose was gray, the unit of it. So gray multiplying by weighting factor of X-ray, it's sievert. شفتوا بالمثال مال يو كي قلنا انه تعرض الى 20 سيفرت. فهم راح نجي على الافكتيف دوز, هو هذا equivalent دوز. ده اوصلكم الفكره انه عندنا absorbed dose multiplying by weighting factor of the X-ray of that radiation. But different tissue have different radiosensitivity. يعني البون مارو, الكولون, lung, stomach, breast, gonads, bladder, esophagus, and so on, they have what we call weighting factor. حكينا بالايكويفالنت الويتنج فاكتور مع radiation. X-ray weighting factor is 1, so we are dealing with 1. But every tissue have different radiosensitivity. شوف الويتنج فاكتور تبدي من 0.12 to 0.01. So what we will get next is effective dose. هو هذا المهم بالقياسات. ما مجبورين تقيسوا بعدين, بس لازم تعرفوا من تقرون اي ارتكل, تقرون اي شيء ومن نحكي على الدوز, هو ان نحكي على الافكتيف دوز. Is a weighted sum of equivalent doses to different organs. مثلا الدوز to brain tissue multiply by brain weighting factor اللي شفناه بالجدول السابق. Dose to thyroid multiply by thyroid weighting factor. Dose to the bone marrow multiply by marrow weighting, and so on. So all of these, some of these, it will give you an effective dose of each one. Brain, thyroid, bone, salivary, and so on. And this is very important for measuring the dose to the patient. How they measuring that? By anthropomorphic dosimetry phantom. They bring a phantom resembling human body, have brain, no brain, something, a simulation of brain, simulation of thyroid gland, this is brain, simulation of thyroid gland, salivary gland, and so on. And they are putting these embedded lithium fluoride thermoluminescent dosimetry, TLD. They putting these small things, embedded these in this phantom, and irradiated that, and later that they read the dose, absorbed dose, and multiply this by the weighting factor of every area. If they want to measure the brain, multiplying by the weighting factor of the brain, salivary gland, and so on from the previous. At that time, they will get the effective dose. These are important for legislation and for doing guidelines. So effective dose in context. Normally, what we get from the cosmic about more than 2,600 microsievert per year, all of us. يعني normally وانت طالع برا تاخذ سنويا 2600 microsievert of إشعاع من كل هذين. Cosmic, it will come 320 microsievert per year. Terrestrial gamma radiation, uranium, you will get 350. Internal radiation, you will get 270. رادون انا اس دي كي برودي, هذا الرادون كان موجود كل شويه بالسويد, كان الجهاز لقياس الإشعاع، فأنا قاعد بالشقة دا أشوف إنه الجهاز ده يقرأ، فخفت وعبالي إنه دا أكتشف شيء جديد. رحت على السلطات قلت لهم، قالوا إيه الحجارة اللي نبني بها والحجارة الموجودة دائما مداعي هي أكثريتها بها رادون، والرادون دائما يصير ديكي، والرادون يبقى في إشعاع. شوف العالم وين قاعدة، قاعدين نص الإشعاع. man made radiation it's about 300 المان ميد قصده انه اللي انت تستخدمه بالدايجنوستيك اكس راي بالثيرابيوتيك اكس راي، بالبقيه انه اللمبه المايكروويف الموبايل والتركيبات كلها انه انت about 300 microsieverts. This is roughly about, if you take an intraoral radiograph or cephalometric panoramic and so on, how much it will resemble by days. This is a vague generalization, not a. but شوفوا إذا تأخذ intraoral كأنما أنه أخذت cosmic for 1 day, cephalometric panoramic for 1 day or so, cone beam about couple of weeks, cone beam CT for craniofacial about few weeks to month, multi-slice medical CT about couple of months. يعني أنه كمية الإكسترا راديشن اللي تأخذها. هذا هم راح نعيد الأسبوع الجاي، هذا كلش مهم. Dose limitation for workers and public excluding patient. أنت any employee age 18 years and above should not exceed 20 millisievert by year. Okay? Trainee age under 18 years should not exceed 6 millisievert. Other persons, including any person below age 16 and all member of public. ناس قاعدة مثل هذا أخونا اللي عنده dental clinic، لازم سنويا المرضى إنه ما يأخذون more than، مو المرضى، الناس اللي قاعد على اعتياد. المريض اللي ياخذ اكس راي ما راح يدخل بهاي المعادله، لانه ياخذ له سي تي ف it will exceed this limit. This is for any workers and public should not exceed this amount of X-ray. The next lecture we will talk about radiation protection, and I will repeat the final thing about dose. Thank you. محاضرة تبين طويلة بس إنه ما أتصور إنه راح تتعبون بيها. Any question in this last few minutes? شنو واحد يسأل واحد يجاوب. 40 people, 16 people. If you don't have any question, we will conclude this lecture because I think you will have to go to another lecture. And sorry if I delayed that. It have to be like finished 10 minutes ago, but never mind.
دكتور عفوا،
تفضل.
انت قلت انه الاشعه عموما هي هارمفul وما اعرف شنو، بس شنو الحل؟ نفسك كطلاب شو نسوي؟
ما اعرف، يعني انا كل مره دا اتعارض وياهم انه جيبوا الفانتوم، دبروا لهم فانتوم، خلوا ياخذون واحد على الثاني. انتم شو تسوون؟ مثل ما قلت الاستاذ معاذ، من يشرح لكم التكنيك، انت تعرف انه باكر الاسبوع الجاي او الشهر الجاي راح يحكي لك على اللور انتيريور توث. قبل لا تروح للكلينيك حاول تطلع من تكست بوك او الانترنت انه الاكس راي مال اللور انتيريور شلون راح تكون. فمن يشرح لك انه التكنيك شو اسمه البوزيشن اوف ذا فيلم والبوزيشن اوف ذا كون والفيرتيكال اند هوريزونتال انجوليشن، ما محتاجين تسوون اكسبوجر لنفسكم. انت تريد تتعلم التكنيك.
دكتور حتى لو هذا يعني هو الدكتور معاذ جاي حاسدنا على اصغر كونكات، اصغر ما اعرف شنو، وتعال عيد يعني شو اسمه الموضوع هو عباره عن درجات، ما علاقه لا بالصحه ولا شيء.
هي اكو درجات. انا يوميا شوف
انه بها خطا كلش صغير.
انتم تقريبا واصلين، لانه صار الكليه صار له تقريبا 5 سنوات موجوده، وصف ثالث وجبه تقرا صف ثالث، وصار لي اني اول سنه اني وياكم. بس تعرف قضايا عندهم اداريه، قضايا ماديه، قضايا ما اعرف شنو. قبل لا ابدي واسوي العقد قلت لهم 1 2 3 وتعرفهم. وانا ليش هسه دائما دا كل محاضره تقريبا دا احرض الطلاب، لانه خاطر يضغطون الطالب اللي يدفع انه ملايين، فما اعرف انه الكليه اذا راح تجي انه اكو فانتوم تقريبا ب 40 ورقه او 30 ورقه ما تريد تجيبها، بس هو هذا الراسماليه انه. فانا من ناحيتي حتى قلت لهم دكتور ضياء وجماعه راح اوصل مرحله الراديشن هازارد اند بروتكشن. ما اريد انه الشيء اللي انطيه بالمحاضره يكون التطبيق ماله عكسي باللاب. ويا استاذ معاذ اني على الخط دائما دائما اقول انه لا تاخذون اكس راي لنفسكم، حاولوا تتنسقون ويا طلاب مرحله رابعه وخامسه. هسه احنا باربيل بس هاي لازم نبدلها، انه صف رابع وخامس ما ياخذون اكس راي. they just refer x-ray to x-ray department. الطالب الموجود بالاكس راي ديبارتمنت راح ياخذ اكس راي للمريض. عندك السيرجري لور 8 لور 6 عندك الكونزرفاتيف كيريوس توث. فهي هاي راح تجي لك الكيسات. هسه احنا بقلبي صف رابع يقرون دنتال اكس راي، انه يوميا تقريبا هم الجروب متكون من شقد تقريبا 30 شقد لا 18 طالب. يوميا عندهم تقريبا ريفيرال اباوت 40 كيسز. يعني كل طالب بده يشوف كيسين الريل كيس، كيريز، ليجن، اندو، امباكتد توث. هنا هم العيادات بدات تشتغل، فالمفروض اللي يتبدل وانا وياهم على الخط، بس الى ان يبدلوه لازم انه الرابع والخامس نيفر ما ينزلون جوا ياخذون اكس راي للمريض اللي يريدوه يصعدون فوق. لازم يسوون ريفير، طلاب صف ثالث ياخذون الاكس راي ويدزوه لهم فوق. هاي انا وياهم وان شاء الله راح نوصل نتيجه.
دكتور احنا ما نشوف اي كيسات، يعني مجرد نكمل ريكويرمنت وهاي.
مو هاي هم راح لازم نبدلها ريكويرمنت، راح يصير غير شكل. بس انه هي السنه من بدت تعرفون انه من تبدي ماكو بلان، تجي انه تقول لهم البلان، تنطيهم الفكره، التطبيق يصير غير شكل. يعني الاستاذ معاذ يحاول قدر الامكان يسوي كل شيء زين لكم. فهو خطيه تشوفوه يعني دا يشتغل تقريبا 4 ايام بالاسبوع وياكم من بدايه للنهايه وما دا يقصر. بس الجامعه اذا ما توفر له الاشياء لازم نبدل الريكوايرمنت. فخلينا نشوف القادم الجاي، لانه وعدونا انه يجيبون هذا الفانتوم. فما اعرف الوعودات دائما مثل ما قلت لكم انه تجي بيوم، تجي باسبوع، تجي بسنه، حكي راح نجيبه ان شاء الله ان شاء الله. فاني كل اسبوع كل ثلاثاء اجي للكليه السلام عليكم شلونك دكتور ضياء؟ ايش سويتوا بالفانتوم؟ بس اذكره خاطر لا يقول انه هملته. وانتم من يمكم، لان انتم دا تدفعون فلوس، انتم الطلاب، الجامعه هي الكم بفلوسكم. مو يجي واحد بالنهايه انه ما يسوي شيء، والله شنو دا اسوي سيفنج فد 20 30 ورقه انه راح اصير ملياردير بهال 20 30 ورقه. فما اعرف شلون الضغط راح يصير. فهاي المحاضره مسجله وراح تصير عندي تربل ويا الجامعه، بس ما اهتم لانه الرساله اللي عندي انه شلون اوصل. احتمال يجي لك ابو الجامع اللي يقول لك انت ايش عليك تحرض الطلاب او انه الهزار. هو ما هو يفكر بفلوس. حتى الرواتب مال الاساتذه دائما يحاولون يقللوها. عندك دائما انه ما يخلوك انه تكون فكره انه تنطي المحاضره بهدوء وانت فرحان. دائما عندك يعني تجي لازم اسبوع مره تروح الذاتيه، عندك مشاكل اداريه. ليش؟ هي بالنهايه انه يسوون سيفنج كم مليم. زين خلا تعبكم اكثر. انتم من يمكم همينا حاولوا. راح اقول للاستاذ معاذ اجين انه الكيسات الريكوايرمنت شلون راح تكون بعدين، بس لازم نوصل لصيغه التفاهم. يعني عملي لازم تشتغلون، بس مثل ما قلت راح نحاول العملي يصير ريفيرال، انه طلاب رابع خامس ما ينزلون جوا، يدزوا لكم مرضى، انتم تاخذون اكس راي لمرضاهم وتدزوها لهم. هو هذا الساري بكل العالم.
دكتور،
نعم.
بالنسبة للمرحلة الرابعة والخامسة المشكلة إنه هم يريدوها للأشعة ياخذوها وياهم وإحنا
خليني
لازم
اقول
نسلمها.
انتم اخذوا له صوره. هو احنا بقلبي شو نسوي؟
إيه
تجي
بس
الاكس راي
الأستاذ يريدها يعني يريد نسلمها، ما يريد صورة.
هم لازم نناقش بيها هاي. خلينا نتفق بالبدايه الرابع وخامس ما ينزلون جوا، انتم تاخذون الاكس راي. الاكس راي عاده اثناء المناقشه واحد يشوف الكواليتي ويخلي الدرجه. فما نريد الاكس راي تكون انه مرتبطه او تلزقوها بالكيس شيت، لانه انت من ناقشتي من شفت الكواليتي مال الاكس راي من انطيتك الدرجه والاكس راي خلاص خل تمشي، او اخذي لها صوره. فانه ما عندنا مشكله لازم الاكس راي تبقى. بس يرضى اقول انه هاي الاشياء يراد لها اتفاق بين الاقسام، بين الكليه كلها تتفق شلون راح تسوي ريفير. هسه انا صار لي انا لوحدي بس دا احكي يوميا إذا أحكي وأجيب وودي بعدنا ما متحركين خطوة. اللي أقدر أسويه إنه أنا إذا أحرر الطلاب نوعا ما إنه تأخذون حقوقكم، فإيد الوحدة ما تصفق. فإذا أحاول قدر الإمكان قضايا العلمية إنه أسويها following وياكم without any compromisation. خلينا نشوف وين راح نوصل. صار لي ساعة بالي عندكم سؤال على
تقدرون تقللون
المحاضرة.
requirement؟
شلون؟
بتقدرون يعني تقللون requirement؟
هسه أسعفكم من هاي بالعمل اللي راح نحكي بيها. سألتكم سؤال بالمحاضرة؟ أعتقد أنه الساعة صارت 12:07 فعندكم غير محاضرة. اللي ما عندكم سؤال related to this lecture بقية الأشياء راح نتابعها ويا الكلية، وانتم من يمكم همين. مو قضية تقللوا الريكوايرمنت، خلينا نسوي اكس راي واحد وننجح. هم لازم تتعلمون، بس طريقة التعليم لازم تكون صحيحة، مو based on the أصدقائكم based on you based on the ethics. زين. So thank you for today and have a nice weekend.